So hi everyone, and thanks so much for joining us this evening. Of course, we're joined by Ruth Bender Atik, who's the director of the Miscarriage Association in the UK. My name's Sarah. I'm the Scotland branch coordinator, and I also manage the pregnancy loss group that we have in the UK. It's a UK-wide group. So if you're not a member of this group already, you're more than welcome to join. We have the group structured in two ways. So we have primary loss, and we also have those who are experiencing a secondary loss. I'll just see if I can share the poster with you. So that's the poster for the group. If you would like to get in contact, my details are on here. So that's my email address. So as I say, the group is managed via WhatsApp, where most of the chat takes place. We also meet up monthly for those who are experiencing primary loss, and we've also got a closed Facebook group as well. So please do get in touch. So what I'll do now is I'll just hand you over to Ruth, who is of course going to share some slides from previous questions that I've submitted. And if you do find that you've got any further questions for tonight, please just put them in the chat box. That'll be really good. Thank you. Okay.
Hi everyone. I'm really hoping I get to share my screen. But this is where you have to sort of talk quietly amongst your, okay, host disabled participant screen, it says, Sarah, so maybe.
Is that something I need to do then?
Uh-huh.
Okay. Sorry, okay. Hold on. Sorry. Is that going to work for you now?
Well, it hasn't come up with that message, so let's hope.
There we go.
Hurrah.
Sorry.
Right. Okay, let's get rid of that. Now, I'm rather hoping you are screen sharing. And you tell me if you can see. I don't seem to have it in presenter mode. Let's try up here.
Yeah, we can see the screen.
Well, you're supposed to be only able to see the slideshow. Rather than all the, oh, here we go.
Yeah.
Here we go. Sorry, everybody. Okay, so first of all, thank you for inviting me to come and join you this evening. I was thinking about this. I've spoken in a couple of places about pregnancy loss and infertility, sometimes with different headings and with different kind of orders of what comes first, if you see what I mean. It's the first time that I've spoken to FNUK, and particularly to people like you who already know the sort of what I think is the subheading here. I think sort of reflects where you're at, which you've got this combination of pregnancy loss and infertility, whichever came first, and it's, I think, the toughest of combinations. So, oops, I'm hoping to move on. So I've called it pregnancy loss and infertility, and I just want to explain what I mean by pregnancy loss, because it means different things to different people. And we're called the Miscarriage Association, but it's because we deal with these three kinds of free 24-week pregnancy losses. So obviously miscarriage, obviously, I guess, in the name, but also in the fact that it is so horribly common. It's around 1 in 4 pregnancies that ends in miscarriage. Most of them, as you'll know, in the first 12 to 13 weeks and a very small number, maybe 2%, that happen later than that. But we also deal with ectopic pregnancy, whether it's a tubal ectopic or a more rare location of an ectopic pregnancy, and molar pregnancy, which is also called hydatidiform mole, which nobody can pronounce or spell, so I feel quite proud of myself. But it is a really poorly known in many ways by the public, molar pregnancy, and it's something that is not only the loss of a pregnancy, even though that we know that the baby won't survive, but it also requires follow-up after a molar pregnancy, because there is a very small risk of a form of cancer called choriocarcinoma, eminently treatable, but very frightening if you're first told that you have a molar pregnancy. And of course, ectopic pregnancy also comes with its risks in the sense that it can be life-threatening if you have a ruptured tubal ectopic pregnancy, and also that it can damage future fertility. So those are the kind of losses that we deal with. I'm just going to pause for a minute. Sarah, I don't know whether you can see on the screen that there's someone waiting to be admitted. I can just press admit if you like.
Yes, please. You're now the host, so I can't admit.
Okay, done. So those are the kind of losses that we deal with. But I think it's really important to know that these are the ones that we also think about. And of course, they're very close. So one is termination of pregnancy. And it's not that this is the focus of our work, but it's an important part of a loss experience. People terminate pregnancies for different reasons. There may be something the matter with the baby. There may be a medical risk to the mother. There may be just situations that mean that you absolutely can't manage a pregnancy at this point. It may be that you're under duress from someone else who wants you to terminate a pregnancy. Sadly, there are also some cases of people who have extreme hyperemesis, extreme pregnancy sickness, and even though this is a wanted pregnancy, they feel they almost have no alternative or have no alternative but to terminate a pregnancy. So termination is also a loss. Stillbirth, of course, losses that happen from 24 weeks of pregnancy onward. And it is bizarre, isn't it, how we have these sort of dividing lines between, if you lose a baby at 23 weeks and 6 days, it's a miscarriage. And there is no formal acknowledgement or need to register the baby, or indeed the possibility of registering. There is no recognition, there's no bereavement leave or maternity leave or pay. If you lose a baby at 24 weeks, the very next day, that is completely different. It is a stillbirth, and there will be a registration. A horrible thing to have to register, but nevertheless, there is a formal recognition of this tiny life. So termination and stillbirth, and I would include embryo transfer loss and possibly other things that I don't know enough about in terms of fertility treatment. When you first think there is the beginnings of a pregnancy, whenever that is, then a loss becomes a pregnancy loss. So I was thinking a lot about the kind of feelings that people have, whether because of pregnancy loss or because of infertility or sub-fertility. And it occurs to me that in many ways, they're very similar. And you'll be able to correct me if I'm wrong when it comes to fertility problems. But there is a lot of overlap, and it's not necessarily a comfortable overlap or even comfort in familiarity, because what you actually got, if you have that combination of pregnancy loss and infertility, is it's a double blow, it's a double burden. So thinking about the people that we deal with at the Miscarriage Association, the people who have miscarriage or ectopic or molar pregnancy, when we talk to them, or they talk to us rather, about the feelings they have, there's a whole load of them, and I'm going to put on the slide here. But if you think about what it is, or the feelings that you had, you might find this top 3 surprising. And I put them here carefully, really. I think it's important for us at least to recognize that for some people, miscarriage, and I pretty much exclude ectopic and molar pregnancy because of the extra complications. But for some people, miscarriage comes as a relief. It comes as a relief for many if this is a pregnancy they desperately didn't want and they were considering terminating. It can also come as a different sort of relief if, like somebody I spoke to this afternoon, you've been told that you have a missed miscarriage. And in her case, it was at 7 or 8 weeks that she was first told that the baby was definitely no longer there, much smaller than the sac size. And she had miscarried, and she decided to wait and let nature take its course. And 7 weeks later, after medical management and then surgical management, there is still the remains of her pregnancy still inside her uterus. For her, when the final part of the miscarriage happens, that will be a different sort of relief. It's a feeling of closure. For some people, miscarriage is a passing sadness. It's regret. That's a shame. I would have liked that. And for some people, it's just a blip in their pregnancy history and they're able to move on quite quickly. Maybe they just think, well, you know, these things happen. And that might be easier if you have a child already. But I don't mean by that if you have a child already, miscarriage isn't a big deal. That's not it at all. It's just that different people have different feelings and thoughts, and that's no great surprise to you if you've been talking to each other. So some of the other things that people talk about, feelings of shock, particularly if you had no indication that anything was wrong, and you go along for your dating scan and discover, like today's lady, that the baby has already died. Feelings of distress, of powerlessness, because there's really nothing that you can do. And partners often feel particularly powerless, wanting to make things better. Feelings of confusion too, particularly in a hospital setting. Grief, loss, not necessarily in parallel or growing with the weeks of gestation. You can feel intense grief and loss at 5 weeks of pregnancy or 6 weeks of pregnancy, or at, embryo transfer loss. Feelings of anger. It's just not fair. I've done absolutely everything by the book. And I know somebody who drinks and smokes and has got 4 children and shouts at them. It's not fair. It isn't fair. Feelings of jealousy are understandable and common. And we're always looking for why. Why did it happen? And you want to know why, because if you don't know why, you'll assume it's something that you did or didn't do. But you also want to know why, because if there's an answer, maybe that means there's a treatment or something that's going to prevent it happening next time. And sadly, even if there is an obvious cause, it doesn't mean that that's treatable or preventable next time. So we often feel guilty. We might blame ourselves. We might blame others. We might blame our workplace. We might blame our partner. We might blame, the area we live in, the environment, the government. It's always good to blame the government from time to time. A lot of people feel a sense of failure and feel ashamed because they're not doing what they're supposed to do, or they're not doing what all their friends can do or seem to be doing. Feelings of isolation. I think you know all this. Feelings of anxiety, and often more than anxiety about the future. Feelings of despair. And we know there's very good, solid research that tells us that pregnancy loss can trigger or exacerbate mental health problems, and can also trigger or exacerbate relationship problems. And if I were to share the screen that I have, that I think reflects the feelings that people have when they experience infertility or sub-fertility, apart from that top row, I reckon they're the same. And I could be wrong. So if you feel that there are, or if you want to share other feelings, I don't know whether the chat system will work. I can't find it on my screen anymore anyway. But, you know, feel free to put those in the chat, or we can add them later and I can learn from you. So I think we're talking about a double blow. And it's a double blow really, whichever comes first, whether you start out by thinking everything's okay and then you have a loss and then you have fertility problems, or whether you have difficulties and problems conceiving and then you become pregnant and then you have a loss. It's hard to know which is worse. So I've got some quotes to share really, just one for each scenario. So people who conceive when they want to conceive, give or take, just assume things are fine. It's not always terribly helpful when people say, oh, just try again, I'm sure it'll be fine next time, because actually you might still be quite worried, as people very, very often are. Pregnancy after loss is tough. Nevertheless, probably if there was anxiety in the pregnancy after loss, it would be after you've had a loss, it would be that you might have another loss. You might have another miscarriage. But if pregnancy loss is followed by not being able to conceive, that can be quite difficult for people to cope with. And then there's pregnancy loss after treatment, after assisted conception. The drive to conceive is absolutely uppermost. And once you get that positive pregnancy test, after that endless 2-week wait, you more or less expect, unless you've had a loss before, that things will be okay. And the same is true if it can take a long time to conceive. So much in that quote, isn't there? Why me? Miscarriage is awful, but we had waited so long and finally got pregnant. Then I had a loss. Now I don't know if I'm ever going to be able to conceive again. So huge feelings of distress and shock and loss. And I think for so many people, whether it's pregnancy loss or infertility, or this combination that you have of both, it marks the loss of hopes and dreams for so many people, particularly for this particular pregnancy, and sometimes to do with the future, which may have a big question mark over it. And it's true that for some people, they don't lose hope, and they don't lose dreams. They are resolute. They might be resigned, but they also think and say, do you know what, we're going to have another go. And having another go at conceiving if you don't have fertility problems is one thing, even if it's full of anxiety. Having another go when you have fertility problems, and if you're putting yourself again through fertility treatment, can be tough. So do people try again? Well, a lot of people will think about it and wonder whether they can put themselves through it again. And actually the same is true for people who don't have, IVF. They don't have difficulty in conceiving, but they don't know whether they can put themselves through another pregnancy and potentially another loss. It's such a lot to put yourself through, especially when it's a double whammy. And some people don't try again. And that's hard. And we have a leaflet called When the Trying Stops. And I think one of the key things in that leaflet, apart from the quotes from people, are that people making that decision is huge. And people talk about, well, we didn't exactly stop trying, but we also didn't use contraception. Or we didn't exactly stop trying, but we didn't go for any more treatment. We sort of thought we'd just wait to see what happens. And people who say, well, we made the decision and then we unmade it. And that can happen several times. So it's time for me to stop talking. I mean, I'm highlighting these, these resources, really, places where you can find support, and they are among all sorts of different places, but Fertility Network UK has to go at the top. You are, as far as I know, the only organisation that in this particular context, you're looking at both those things together. So we at the Miscarriage Association have had lots of support from FN UK. It was Kate Bryan who co-wrote, who was part of FN UK for many years before, when it was Infertility Network UK, and she and I co-wrote our leaflet on pregnancy loss and infertility. You guys refer to us, we refer to you. It's a great organisation, I think. BICA are the only place I know of that are sort of very much approved for counselling specific to fertility problems. I think the Ectopic Pregnancy Trust is a great organisation. It's pretty clear what they deal with. And they are, of course, used to people who sometimes after ectopic pregnancy will lose first one tube and then another tube, and are then looking, if they are wanting still to conceive, looking for assisted conception. Miscarriage Association, I'll talk about in a minute. And I've put social media at the bottom. Social media, the good, the bad, and the ugly. It can be such a fantastically supportive resource. Facebook groups, private spaces. And sometimes it isn't. Sometimes it's very upsetting. Sometimes people, when they can say whatever they want at the touch of a key, say stuff that perhaps, well, you'd hope they might regret it, but it can be hurtful too. As can people who love you, but not meaning to hurt, I mean. So a bit about us. So we're, like FN UK, a registered UK charity, and really the core business of what we do is providing support and information. And it's support, it's not counselling. Support very much along the lines of listening, understanding, acknowledging, recognising, never judging, taking as much time as is needed. And we provide information, and it's information and not advice. So it's not medical advice for sure. And it's also trying not to advise people about, you should perhaps go and see this clinician, or you should go and see that clinician. And the way that we do all of this is, as you can see, so we have a staffed helpline 5 days a week. And that's, like the old-fashioned helpline when you pick up a telephone. But it's also email and live chat and direct messages. We have support volunteers, peer support volunteers, people who've been through pregnancy loss themselves, and they run support groups. So we have face-to-face support groups in some parts of the country, not as many as we used to have before COVID. And we have groups that meet on Zoom. which are the only thing I can thank COVID for, because it meant that people still had support and they've continued to be popular, I think, because as here, people have the option, it might have been Sarah's choice, but people have the option not to have their camera on if they don't want to. And they can either speak or not speak, or use the chat or not use the chat. So it can feel like a very safe environment. But it does mean that you miss somebody reaching out to you literally and touching your arm or having a cup of tea together. Pluses and minuses. And we have an online forum. And a lot of the information comes from the helpline team too. I mean, a lot of it is about kind of explaining terms and terminology or processes. Because when you're told stuff in a hospital setting or somewhere where you've received difficult or unexpected news and you're under stress, it's really hard to A, ask questions, and B, remember what the answer was, and C, actually understand what was said. But we also have leaflets, rather a lot of leaflets, which are all free. And we have loads of stuff on our website, information in particular, information about research, information about different kinds of pregnancy loss, about the facts and the feelings, and also personal stories. And in addition to that, we work to raise public awareness, and we also offer training to workplaces around and advice around having supportive workplaces. And we also support and promote the best possible NHS care. I said we had a lot of leaflets. So these are the ones that are sort of general and are relating to pregnancy loss. They're pretty self-evident, except that on the right-hand side, in the middle, we've got recurrent miscarriage, which I'm just having to rewrite because of some new guidance that's come out. Pregnancy after loss is probably the highest, well, one of the highest hits, as it were, that we get. People have such high anxiety. And a leaflet that's for family and friends, supporting someone you know, because they mean well. They don't always get it right. And that's where you can find them. And here's just a few more that I think might be particularly useful. So the leaflet on the far left, which we did, as I said before, with FNUK, thinking about another pregnancy, looking after your mental health during and after pregnancy loss, and when the trying stops. So that's us. I'm not sure our website looks like that at the moment. I'm feeling a bit anxious about our website. I think it's brilliant, but I happen to know, well, of course I know, that we're in the middle of kind of updating it and making it easier to navigate. And it will be much easier to navigate. But at the moment, I can't find what I'm looking for. So that's a bit of a stressful situation. So I'm going to stop. Oh, I can't stop sharing because I need to show you this next screen because it's time for questions and comments and time to talk. But I've already got some questions, so which Sarah sent me. Thank you, Sarah. And I'm just going to go through those to see what I can answer. So that was the first on the list. And I hope I might have answered that already, but if you've got any extra questions, put them in the chat. And once I have finished this screen, I'm going to close the screen so I can actually read the chat because my eyesight is rubbish. So support. What advice would we offer to anyone who's experienced miscarriage? Is such a broad question. And it's sort of got a horribly short answer, which is none. We really don't advise. What we aim to do is to try and find out what help somebody needs and what they're thinking about, asking about, worrying about, distressed about, angry about. And if they're wanting some information or a guide, like, for example, should I try again? Or what are the chances of me? I mean, if it's what are the chances of me having another loss, we can't give them the answer because we don't know. We can talk about it in general. If it's something like, you know, I've got these 3 different options for managing my miscarriage, which should I choose? We wouldn't advise them on that either, but we talk through the pros and cons. It's always about helping somebody to talk it through. That's what we do. Family and friends can be so supportive, so thoughtful, so kind, and sometimes they'll get it wrong. And I suspect I don't need to tell you much about that because you'll know the things that people say, which in the great British tradition are meant to cheer you up, but don't always. So if I give you some examples from, you know, around miscarriage and pregnancy loss, it's pretty much anything that begins with the words at least. At least it was early. At least you have a child already. At least it wasn't really a pregnancy yet, was it? It was more a bunch of cells. At least you can get pregnant. I know somebody she actually had 17 miscarriages, and then she went on to do XYZ and just had a baby. And that kind of merges, doesn't it, with some of the fertility issues when people say things like, I know somebody who, or I expect it happened, miscarriage, or didn't happen, conception, because, long list of helpful things that you should have or should not have done. Or, you know, if you relax, you know that one. I'm sure you know that one. If you relax, everything's fine, because if you relax, you'll immediately conceive and you'll go to term and everything will be fine. So I think the answer, if people ask us, you know, how can I get my family to support me? We'll say, well, maybe use our leaflet, which is the supporting someone you know, and sort of just, you know, drop it by. Because when we ask people who've had pregnancy loss what they find helpful, it's when people say, I'm really sorry. I'm sorry for your loss, right? I'm sorry for what you're going through. I don't quite know what to say. Is there anything that I can do? Do you want to just come for a walk? We don't have to talk about it if you don't want. It's about, sounds so silly, doesn't it? And it's so obvious. It's about being thoughtful. It's about asking a question like, how are you doing? It's about remembering to ask them again in a month or 3 months, or maybe when the baby was due, or maybe when, you know, they're going to try again. It's about them just listening, really, really listening to whatever it is you have to say. I think we've all met people who say, you know, is there anything I can do? Or I'm really happy to listen. And they're sort of looking at their watch at the same time. They're not really comfortable. You just want people to be there for you. I reckon FNUK could take our leaflet about supporting someone you know and translate it into fertility issues. And that might be useful. We have, as I said, face-to-face support groups and the Zoom support groups, and they are on our website in the section that is headed. The tab is How We Help. And you can click on the support groups link and it will tell you where the groups meet and when they meet. So investigations. This is all very brand new. It's brand new because up until Monday, last Monday, 2 days ago, people usually had investigations for miscarriage only after they'd had 3 consecutive losses. They had to have not just 1 miscarriage, not just 2, not just 3, but they had to be one after the other after the other. If you had a pregnancy in between, that sort of meant that it's like failing at the first hurdle, but it means that you sort of go back to the beginning. So that is no longer going to be the case. There will still be, this is new guidance that's come out from the Royal College of Obstetricians and Gynecologists, which is that recurrent miscarriage is still considered to be 3 early miscarriages, but they don't have to be consecutive, which means that, you know, whether or not you've had a child in the middle, you will still be able to have investigations. I should say that there are also recommendations, and always have been, that, you know, there can be times when you don't wait until there are 3 miscarriages. And that might be if it's, you know, seems pretty likely that there is some underlying cause because maybe of other health conditions or pregnancy or fertility history. Or it might be because of age. Because why would you wait for someone to get pregnant again if they are already in their late 30s or early 40s? Those are the kind of reasons that you might offer investigations earlier. Of course, the other one is if you've had a second trimester loss. For the most part, those people are offered investigations after 1 late loss. There's all sorts of bits and pieces of research going on in the UK, or that have gone on and continue to go on. You tend not to hear about them unless they hit the headlines. So you don't hear about the ones where a drug is trialed and it's found not to be helpful, or when some other kind of form of treatment or process or something doesn't seem exciting enough for the media. So you tend not to hear about it, but there is research going on, and sometimes it's bench science. So people are looking at, you know, the endometrium and the quality of the endometrium, and does it make any difference in terms of conceiving in the first place and then maintaining a pregnancy. Or there is, I mean, I'm sure you'll have talked about progesterone and the role of progesterone. I mean, we know that progesterone doesn't prove to be useful for people who've had recurrent miscarriage, in the sense of taking progesterone for the next pregnancy will reduce the risk. It hasn't shown to be that way. But it has shown that it's quite useful for people who've had previous losses and who then have bleeding in a subsequent pregnancy. So there is some usefulness in progesterone, and of course it's also used in infertility treatment. So there is research going on, and there's never enough. We're never, ever, ever going to reach a point, sadly, where there are no miscarriages. It won't happen, but it would be really nice if there were fewer, or we knew more about how to reduce it, or how to reduce the incidence. Free counselling. Not many places. In theory, NHS, psychological services, some of the new perinatal mental health hubs are offering counselling, and certainly some, it might be short-term, it might be CBT for after pregnancy loss. I mean, and it has to be people who understand this, because a general counsellor doesn't always understand. But there is a charity called Petals, as in flowers, and it's worth looking them up online, because they do offer free counselling and they totally understand early loss and late loss. I'm not sure about the answer to this. The actual question was, how can I help the Miscarriage Association lobby for change and better care? We don't do a huge amount of lobbying. We just kind of work a bit, possibly too quietly. So we work with the all-party parliamentary group on baby loss and the National Bereavement Care Pathway. And we work and sometimes advise quite strongly Department of Health and Social Care work that's done on aspects of pregnancy loss care. I think there's a great deal to be said in lobbying your own trust or whoever is commissioning fertility services if you're not happy with the service you're getting. And with finding hopefully and persuading your own MP to lobby for things for you, and finding other people who are willing to do this as a group. So there are different ways of making change, but goodness me, it's hard. And this is one that Sarah sent me this morning. And if you're in this group and you recognize this, I apologize for editing it. I just shortened the sentences a bit. I thought it was such a thoughtful, interesting point that so many people, when you're trying to conceive, for whatever reason, you're getting near to the end of your fertile years. Well, obviously, I mean, it's taken a while to find out, or all sorts of different reasons. For me, it was not finding the right guy until I was in my mid-30s. And age is significant. There is no doubt about it. When it comes to pregnancy loss, the top risk factor for another loss is maternal age. So the older, which kind of makes sense. I mean, the older we get, the older our egg cells are, and some of them, as it were, get past their sell-by date. So it can take us longer to conceive. And when we do conceive, there's also a higher risk of loss and also of chromosome abnormalities. But having said that, you can have chromosome abnormalities in the paternal side too. So that when you're looking at a miscarriage, it's not just about woman's age, which is the prime issue, but it's also about the partner's age, about paternal age. And age isn't the only factor. The second factor is history. It's the number of miscarriages you've had already. And also fertility issues, because we know there's a link between the length of time it takes to conceive and the risk of miscarriage, which sort of makes sense in a way if you think about it. Our bodies aren't kind of set up in boxes. So age is absolutely a factor, but it doesn't mean it's the cause. And I think it's important not to be fobbed off. It's so much easier to say than to do, isn't it, when you're feeling vulnerable and distressed? But it shouldn't be that because you are X years old, you can't have any further investigations. It's important to have investigations. It may be that nothing in particular is found. It may be that they are able to do some genetic tests on the remains of a pregnancy. It may be that they will do some genetic tests on the woman and her partner, and they will discover that there is some chromosomal imbalance or a balanced chromosomal problem which doesn't affect either partner but can affect the baby. So there are other things that can be looked at, including blood clotting factors. So I think it's a really important question, and thank you for bringing it. Now I promise I really, really am going to stop share. And I can see the chat. Sarah, do you want to come back in?
Thanks for that. Thanks so much for that, Ruth. That was really good. Yeah, just a couple of points really. I loved how you described social media and you called it the good, the bad and the ugly. I thought that was very apt way to describe, because it is very much that. It can be really good, but it can also be very unhelpful. Also, I realised as well when you were sharing your information about further support that I have not included the Ectopic Pregnancy Trust in my further information and support. So I'll make sure that I rectify that, because of course it's really important, and there is a slightly higher risk of having that after IVF as well. So I'll make sure that I get that included. I'm really glad that you were able to give some information as well about free counselling services. So obviously I'm the Scotland branch coordinator, and it's very pertinent to me how different it is across the UK in terms of services and fertility treatment and NHS funding. So in Scotland, we are fortunate that if you are attached to a fertility clinic, you will have access to a specialist infertility counsellor. So the 4 main clinics in Scotland all have at least 2 infertility counsellors that you can access for free at any point during your treatment, which is great. However, this is certainly not the picture in other parts of the UK, and especially so in England. So what I'll do is I'll have a look at that charity, the Petals charity, and I'll make sure that everyone's aware, and I'll make contact with them so I can share that information with the community that we support, because it's really, really important.
Sarah, I should say that in Scotland, there are 2 organisations that say that they offer counselling for miscarriage, not fertility problems, as far as I know. One is, I think it's still called the Scottish Council for Information on Miscarriage. It might have changed its name somewhat. Okay. And there is one called Held in Our Hearts, which is much more about later loss, but they do offer counselling and support.
Yeah, I know about that charity. We're also on a care pathway in Scotland here, and
yes,
part of that. Yeah,
I am
well.
too.
Yeah, it's a really good.
The National Bereavement Care Pathway. I should have done. There's one in England and there's one in Scotland now.
Yeah, yeah. We've also got a community as well, which I should promote more often too, and it's called. There's a forum called Health Unlocked. So we've got 3 communities on there. We've got the Try and Conceive community, and on that we've got about 4,500 people in that community. But we've also got a pregnancy support community, and we do understand as a charity the anxieties around pregnancy after trying to conceive for a really long time or having treatment, and especially so after having loss. So that's also another good community to join. It's the administrators on this community are all FN UK staff, so we do closely monitor the chat and things like that, but it's a really good community to be part of. So yeah. And also just about your website, Ruth, as well, I just wanted to say that I think the website, the Miscarriage Association, it's such a good website. I've actually used it quite often myself, just for some advice and information, and in particular that supporting someone you know leaflet has been really, really good, because we do have a similar leaflet, but yeah, it is something that I share with everyone. It's a really good resource, so I'll be looking forward to the updates to the website and see how that looks, because that's something I think Fertility Network UK want to look at some point, hopefully in the very near future too. Okay, so will we just have a look at the chat?
Yeah, this is so helpful. I'm sorry, I'm supposed to be helping you guys, but you're really helping me by telling me more about those feelings. I mean, yeah, impatience. I hadn't thought about that, but gosh, yes. Feeling numb and empty. Yeah. And being worried about time pressure. Yeah, that's so important. Desperation. I know I'd put down despair, emptiness again, lack of confidence. Yes, I think that's important. You kind of, people talk about my body's failed me. My body's let me down. That's such an awful feeling. And yet, if you're on the phone with somebody and they talk about that, you know, sometimes it would be, you have to be careful how you do this. But actually, maybe your body actually hasn't let you down. It's done the very best it could be. You know, it's done the very best it could do under these really difficult circumstances. And that's a sort of a different way to frame it, a different way to think about it, if you possibly can. But of course you lose confidence. And you can use, when you lose confidence in the area of fertility, you can then start, or pregnancy loss, you can start losing it elsewhere too. You just think, well, you know, if I can't even do this, maybe I can't do that. And that's a very difficult place to be in. Yeah, I'm reading this one. The first time was shock. The second time was feeling naive to think this time was different. Oh, but of course you would. Of course you'd think it's going to be different. And then knowing what to expect and going through the motions like a robot with a lack of emotion until it hits you after a delay. And that, yeah, people often say that, and people talk about, you know, when you're in the middle of something, you just kind of deal with it because you haven't got a choice. You haven't got time to think and to feel sometimes. And then you think, okay, I'm going to be okay. And maybe when you get your first period after a loss, such visceral physical reminder, sometimes of the loss itself, but also of the fact that by rights you shouldn't be having a period. And then when you get to the due date or close to the due date, and you're thinking, well, by rights I should be on, I should be on maternity leave now. So all of those things are hard. It doesn't follow, I think, that, you have a loss, you feel bad, you feel a bit better, and then you're on. We don't work like that. We're just individuals, and the feelings come and go, and then they hit you out of the blue because of a piece of music, or because somebody on Facebook decides to share her picture of her scan, and you have to be delighted for her, or you might unfriend her, which seems a terrible thing to do, but it's just the way that you cope. And Christmas, yeah, dates. I mean, other dates that are significant: Mother's Day, Father's Day, Christmas. All the sort of festivals, the times that everybody's busy celebrating, and you feel like you're not, and you can't. And people talk about Mother's Day, don't they? They talk about, actually, was I a mother? Am I a mother? Was it a baby? Or was it just a bunch of cells? Or was it just a pregnancy? Everybody feels differently about it. But for some people, getting a card on Mother's Day, acknowledging that you have been a mother, are a mother, were a mother, can be helpful. And other people would find it incredibly upsetting. So it's difficult. Chemical pregnancy. Do you know, I don't think the term chemical pregnancy is helpful at all, because a pregnancy is a pregnancy. Once you've, a chemical pregnancy basically means that you had a positive pregnancy test, and after a few days, it became a negative pregnancy. So there was a conception. If you know, as very often in fertility treatment, you do know that there is a conception, then you start thinking baby. And it's what it means for you that's most important. So calling it a chemical pregnancy, I think, isn't helpful for many people. And for other people, they'll find it helpful, because then they don't have to think of it as a lost baby or a lost pregnancy. And goodness me, the terminology that gets used sometimes. So I don't know how many of you have heard of the term blighted ovum. Blighted ovum, dearie me. So blighted, well, disease, isn't it? And something very wrong with it, like potato blight. And ovum puts it firmly, the ball in the woman's court. So you've got an egg that's rubbish. I mean, that's a terrible thing to say, and it's also inaccurate, because what you've got is you've got the beginning of an embryo. You've got conception, which is because of the egg and the sperm, and something somewhere there is wrong. There's an error, and so the embryo doesn't develop enough. By the time you get to see a pregnancy on scan, you can't see an embryo anymore. You can't see a fetus and you can't see an embryo. It just means that it's an early loss. Calling it a blighted ovum is unhelpful. Sometimes it's called an embryonic pregnancy, which is jolly difficult to say. I think actually that kind of pregnancy loss is also particularly difficult, because one of the things that characterizes it is that you still get pregnancy symptoms. And that can be extra cruel when you go for your scan. And you're feeling hugely, you're feeling very pregnant. And then you're told, no, not only is there no living pregnancy here, but, it's just a blighted ovum. A juggle at work when you need IVF every year. Yeah. We've done a lot of work, and we're still doing a lot of work with organizations around pregnancy loss support at work, or having a policy for pregnancy loss. And it's quite interesting because a lot of the organizations who are now creating policies, which are, supportive policies, are also thinking about fertility issues. And the co-op is a very good example. They've put together their policy, so they look at fertility issues too. It's also come, interestingly, around the same time that organizations are beginning to think about menopause. We don't want to be thinking about menopause, this group, but the point is there's becoming a bit more understanding about women's health and also about how it affects their partners. And you know what? The bottom line is, it's good for a business. It's good for an organization. It's good for, a city council or for a university or for a government department to be, or the NHS actually, to be thinking about their staff and helping them through, because then you get, you get more commitment from people. And you're right about this whole issue about, how much do you talk about it at work? How much do you want to expose yourself? And always the niggling anxiety of, if people know I'm trying for a pregnancy or trying again, are they going to be sort of quietly discriminating against me? It's against the law, but they might anyway. So might I miss the opportunity for a promotion? Or might I be in line for redundancy? Or are they counting the number of days off? It's really, really tricky.
It's something that we try and work towards as well. So we've got a fertility in the workplace project, which has been going for a few years now. We've actually received a substantial grant from the Department of Health in England. So we are keen for employers to recognise, how disruptive fertility treatment is in people's working lives, the amount of time that they take off. So yes, it's really important that employers recognise this. We actually got quite a distressing email from someone a couple of years ago who was having difficulty with her employer because she needed to take time for IVF. And the employer, and this is a local authority as well, the employer said that they didn't see fertility treatment as essential and it was no more than a cosmetic procedure.
Oh God.
So that was awful. But the member of staff who dealt with that, Sharon Martin, I mean, she took it right to the top of the organisation. It was just horrendous to hear that. In this day and age, it just shows a complete and utter lack of understanding and compassion. So yeah, it's really important, and it's really difficult as well if you don't get on with your employer. That can be really tricky as well, how to approach your employer. But again, that's something that we can help support you through as a charity too.
That's good. So I'm continuing on the chat. Yeah, I mean, mental health can be really, really impacted negatively after pregnancy loss. And yeah, I'm really trying to work on being happy with my life. That's hard. Some of the time it's just about getting through the hour, getting through the morning, getting through the day. And knowing that it isn't a straight line of recovery, that it can take time and that there are very often ups and there are very often downs. And the downs might be not as deep down as they were before, but they can make you feel like you're going backwards. Antidepressants can, often be helpful, just helping you get through. And so can talking with someone who understands, whether it's official counselling or contacting one of the support organisations or somebody else like in your private Facebook groups who, somebody who gets it and who offers understanding and support unconditionally. Doesn't tell you to cheer up. Things could be worse. How helpful is that? Questioning everything I did. Oh, yeah. Yeah, did you lift something? Did you work too hard? Did you do too much? Could you have done something different? Did you eat spicy food? Did you hoover? Did you think that maybe this was a pregnancy you didn't want, as that somehow filtered through. You know, if you think about, and you don't think about, do you? Because we don't anymore. Although I suppose in the States they will. If you think about people who want an abortion, it's very difficult to cause an abortion. You know, in the 1940s and 50s and the early 60s, women were drinking gin and having hot baths and using knitting needles and all sorts of implements in order to induce an abortion. It is very difficult to shift a pregnancy that is developing normally, really difficult. So if you have a major blow to the stomach because you've fallen off a horse or you've been skydiving or whatever, even then a normally developing pregnancy is pretty well protected because it's in a bag of liquid, liquor. So it's so unlikely to be anything you did or didn't do, assuming you're not, you know, hugely drinking vast quantities or going on binges or drinking very large quantities of caffeine or smoking a lot, especially if it's crack cocaine. And the chances are that you probably aren't. The chances are that you're probably doing exactly the opposite, which is doing absolutely everything by the book. And it makes no difference. I mean, okay, it does make a difference. So, you know, don't eat blue cheese and all that stuff. But while it's really good to do all you possibly can do to get yourself fit and healthy before conception and when you're pregnant, it's very difficult to prevent miscarriage unless you've got a diagnosed problem for which there is treatment. So one of the blood clotting disorders, antiphospholipid syndrome, can be really helped by having aspirin and heparin. But even if you have that diagnosis and you have that treatment, you might miscarry because of a random chromosome abnormality. So you've done everything right and more besides, and still it can happen. Don't blame yourselves. Don't.
That is good advice, Ruth. See, don't blame yourself.
Yeah, it's so much easier to say than to do. I mean, I know I can say these things. You're all going, oh yeah, what does she know? That's fair enough. This is interesting. No rituals that help to give closure, no place to mourn, no physical items to keep. It's like it never happened. I totally get that. But you can create rituals. You can think about creating rituals. You can create a ritual for embryo transfer loss. This was a little life. It lasted the briefest period of time. Light a candle. Remember the date. Plant a flower for the seed that won't flower. Just make a memory that makes it important for you. And people do. You know, there's Baby Loss Awareness Week once a year, the 9th to the 15th of October. And sometimes people join up and do stuff. They will have candle lighting or some kind of service of remembrance. And sometimes people don't. They just think about it. I know someone who, we're up in Yorkshire and she's up in Yorkshire, and she had loss after loss after loss after loss. And she was a fertility nurse. So she managed to conceive, but she kept having miscarriages. And at some point she decided to stop. All through that time, and somewhat less since, was many years ago, she used to go and climb up Ilkley Moor, as in Ilkley Moor Bartat, and yell her head off with her anger at God. And she felt much better afterwards. Because it's expressing how you feel, and why not? I mean, it's probably best not to do that on a bus. But yeah, I think finding rituals, finding meaning, doing a drawing, writing something in a diary of loss, a diary of a pregnancy that wasn't, a diary of something that you're going through, expressing it and finding other people who get it. And yeah, once you're 40 plus, options do start diminishing. And goodness me, the costs are huge. If you're going through private fertility treatment and you're not getting any NHS funding, it's humongous. Yeah. A year which otherwise you could be brightful with things you could do with your non-reproductive potential. That's beautifully expressed. Silly things that remind you of loss. Yeah. Knitting a sanitary bin at work was a massive trigger. Of course, because you've gone so long without a period. Oh, yeah. Yeah. Trying to go ahead with egg donation. And then finding out you're pregnant. Oh, I'm so sorry. You've miscarried 3 weeks ago. I'm assuming, can everybody read these?
Yes, it's to everyone, yeah.
Yeah. Oh. So hard. How on earth does anyone ever move on? I think some do and some don't. And some are just absolutely determined to have another go as soon as they can, if they can afford it, both financially and emotionally. And for some people, it takes time. You also, sometimes just need time to be you and trying to remember who you are. That you're not just somebody trying to conceive, not only somebody trying to conceive. Know whether it's time to move to using donor eggs. Yeah. And yes, a miscarriage can still happen. Do you know, that's a question I don't know. Does the risk reduce with younger eggs? I think logically it should, but also there may be changes to the uterine lining and to your level of hormones and whatnot. And you can really tell I'm not a medic, can't you? Because medics wouldn't say whatnot, but it's the best I can do.
I can have a look at that, though. That's a really good question, actually. It's not something I'd thought about, because certainly in this country, we're regulated by the HFEA, and the guidance says that we should be using our own eggs from about the age of 45 anyway. And there has been an increase in women using donor eggs between, the 45 and 51 age group. The report came out yesterday. So yeah, it's yeah, I think I'll have a look at that, actually. It's quite interesting, but I can't imagine that the risk or the chances would be lower, because if they're offering donor eggs, they've done that assessment where, there's a good chance of having a live birth, and essentially that's how the clinics make their decisions. But yeah, I'll see if I can get some more information on that. It'd be interesting to know.
And nobody's mentioned surrogacy. And I know that surrogacy is the way that some people go. And surrogates can sometimes have miscarriages too. And that's awful for everybody, including the third party, who will usually feel sad and often very guilty that they were there to do this for you and it didn't work. And then you might spend time thinking, you know, do we try again? Or do we look for a different surrogate? So that's an even more complex situation to be in. And having said that, sometimes it can be wonderful and it works.
Thanks, Ruth. I think that's the end of the questions for this evening, but thanks so much, Ruth, for joining us. That was a really good session to have. It was really useful, and I'm sure you know, there's lots of information there that people will pick up. So thanks to everyone for joining us. It will be uploaded to our YouTube channel later. And again, as I said earlier, if you would like to join our pregnancy loss support groups, you're more than welcome. Please get in touch. Just visit our website, Fertility Network UK. We've got Trying to Conceive groups there, as well as regional groups and UK-wide groups. So I hope everyone found this evening useful. Thank you so much for joining us, and thank you again, Ruth. Until the next time.
Bye.
Good night, everyone.